My second pregnancy was very difficult. It was totally different than my first pregnancy. And my husband was deployed. And so it was really hard to deal with alone. But when I was 4 months pregnant, I got a call from the nurse that Athena was diagnosed in utero with cytomegalovirus, CMV. And it kind of shattered my world when she was diagnosed. It got to the point where I would get upset if she moved because they told me she could be having seizures in the womb.
I was out to sea. We got the call. Of course, I knew nothing about CMV or what it was, so a lot to digest, not to mention the stress of being away and not being able to do this face-to-face added a little bit to it, but we got through it.
No, when I went into labor, I didn't want to go to the hospital. I was kind of scared, more so than with my first. My mother was there with me. We went to the hospital, and it was a very difficult labor and birth. But she was only 5 pounds and 15 ounces. So when she was born, she passed all her checks and everything on the ears and eyes. And we had to go through her specialist. It was 6 months of labs and her getting her blood drawn and scanned over, and it was a lot. But thank God, after they had her on this medicine to try to preserve her hearing and her eyesight, at 6 months, we saw asymptomatic, and her specialist cried. Like, she is literally a miracle baby.
CMV is called cytomegalovirus, and it can be, in children, it can present either congenitally or later in life as acquired. And acquired, it's usually in children who are immune compromised, HIV, or after a transplant with chemotherapy. But in Athena's case, it was congenital. She was born with it, and this usually affects 1% of the population, congenital CMV. And she luckily did not have the worst ocular manifestations of CMV, which is a retinochoroiditis. She, in fact, did not have any retinal pathology within the CMV, but she did require glasses, and that's what we were able to help her with.
We got stationed in Key West, and I found out there was no pediatric ophthalmologist down there. So I went online and I did some research. I found Nicholas Children and Dr. Lux, and the things that were said about her, I imagined Athena would respond really well. She kind of has white coat syndrome because she went through a lot when she was little. And immediately, Athena just responded to her. And it was amazing to see her interact with the doctor in a positive way like that.
When we had a chance to do a full exam, we luckily noticed that she did not have the worst vision complications of CMV, which is inflammation in the back of the eye. But she did require glasses. She has what we call refractive amblyopia, hyperopic astigmatism. And so she needed glasses to help with both of those things. And so once we were able to give her the glasses, we noticed a big difference in her personality, in her ability to do well at school, and her overall demeanor completely changed.
And once she realized that she could see better with them, it was so cute. Mommy, I can see. And until she's about 5, they said, I have to get her checked every 6 months. And so we drive from Key West to Miami every 6 months to come see Dr. Lux, because she is the only doctor that Athena has ever responded to like that.
The big learning point from Athena, I think, is that we really see in a child like Athena, something as simple as glasses really changed her entire personality, her behavior, her ability to make friends, her confidence. And I think these are all things that we might take for granted, but it really can make a difference in a child's trajectory. Parents, if concerned about squinting or blinking, please bring them in. Please ask your pediatrician to refer them to an eye specialist, and we can at least make sure that it's not an intervention as simple as needing glasses that could help them.
Without the glasses, Athena she would squint when looking out far away. She would hold her tablet real close to her face. We could tell when we were reading books that she couldn't really see the words because I'm holding them at normal distance. And then once Athena got her glasses, it was like night and day. She could calling out numbers at the grocery store, on the aisle, and she could see a lot further. It was a big change for her and for her quality of life.
I can see.